All right, so a physical therapist or a doctor told you you need to work with dilators, or maybe you're a provider who wants to become more proficient or have a better understanding of how to utilize dilators. Dilators are these wonderful products that increase in size and can be placed in the vaginal canal to help stretch those muscles. So let me go ahead and explain first who typically gets recommended dilators. So in another video, I talk really fully about what is the pelvic floor. Briefly, the pelvic floor is a group of 26 muscles, and how those muscles are oriented is we have a very superficial layer that's closest to the skin. Then we have a second layer that moves inside of our body, and then a third or deepest layer that's closest to our internal organs and really helps to support those. So unlike other muscles in our body, the pelvic floor does not have a joint. So you can't stretch it like you can stretch your hamstrings or the back of your leg. So in order to stretch these muscles, we have to use something like a dilator to help get that tissue length and flexibility. Commonly, people who are diagnosed with pelvic floor tension myalgia, which is just a fancy way of saying you have tightness in those muscles and they are also tender. People who have pain with intercourse, or maybe pain with speculum exam or tampon insertion. Oftentimes individuals who are having urinary incontinence or constipation. Our pelvic floor muscles lack oftentimes that flexibility, that length. So even though we might think, gosh, I need to strengthen to improve that, actually, you need to first lengthen, get that full range of motion. Once that is returned, then we can talk about strengthening. So right now I'm gonna focus on the lengthening part. So like I said, there's lots of different types of dilators. Most commonly, they're made of a silicone or a rigid plastic. We also have some acrylic ones, and we'll be showing you more close-up options in a short bit. So these dilators increase slowly with size. What you're going to do is you're going to work with your physical therapist or your provider to see what size dilator do I need to work towards. Oftentimes, for me, I like to have people kind of have a goal size dilator. So maybe this person isn't with a partner, but they have a favorite intimacy aid they like to use. Maybe someone is with a partner, and so we kind of know the size dilator that corresponds to their partner. Maybe they don't have a partner, they don't have a favorite intimacy aid, but they hope to maybe be intimate in the future, or they just know they want a more comfortable speculum exam or ability to place a tampon. Then we kind of come together to figure out the size that they're going to be most comfortable working towards. So I like to combine where they're at along the process of getting to their goal size dilator, as well as what I'm feeling as a physical therapist when I'm pushing on those tissues. This is a great measuring stick so that the patient can feel confident moving forward with whatever tasks typically feel painful. So the purpose of the dilators are to get that length and flexibility of the muscle. Many people are always concerned about, Laura, will I just be loosey-goosey and floppy and nothing's going to engage? And you know, it'll just feel, I had one lady say like her husband was going into a cave. She was very concerned about that. No, you're not going to be loosey-goosey. What you can go ahead and do to test your theory or test your worry is do a hamstring stretch. See if you can touch the floor with your fingers. I cannot touch the floor with my fingers. So I can stretch my hamstrings, I can get length, and sure enough, the next day I show up, I go to touch and get to that same length and I can't get it. So it takes me stretching every single day to be able to eventually touch my toes. I still have excellent strength in my hamstrings, but now I have more flexibility. I have more capability to engage those muscles. Let's go ahead and talk about how we're going to apply the dilators. So I'm going to leave the specifics of how frequently during the week and the length of time you apply the dilators to whatever provider you're going to. But I think it's important that patients really work on setting the stage. So when you're going to do the dilators, I want you to go ahead and get into a comfortable place. Oftentimes, or for me, that place would be in my bedroom. I want you to have the lights dim to whatever level is comfortable. Maybe play some music or something that's relaxing to you. Make sure it's warm enough in your bedroom for you to be comfortable. Then what you're going to do is, depending on what dilator you decide, you would apply lubricant to the end of the dilator, and then you're going to insert it slowly, kind of aiming for your low back. If you feel any discomfort as you're inserting the dilator, I want you to go ahead and stop, move that dilator back, take some deep breaths, check with your legs and your hips to see if they need to be better supported. Maybe your tummy is too active and you need to relax that. And then you're going to go ahead and further insert the dilator. Again, breathing and focusing. So dilation is a great way to work on muscle awareness as well as muscle flexibility. You can really tune in to see, am I contracting around this dilator or am I relaxing and releasing? Once the dilator is in place, you're going to go ahead and work on that nice relaxed diaphragmatic breathing. I have a video about that, so make sure to check that out if you feel you need further guidance. And then after you're done, for whatever time you and your therapist came up with to apply this, you can go ahead and slowly remove that dilator, wash them simply with soap and water, and then move on with your day. So we're going to talk about this in a little bit to show you all the different types of dilators, but I'll also talk about appropriate lubricants to use. So these dilators help us to gain muscle awareness, confidence that something can be in our vaginal canal without pain, and they gradually expose us to the stretch so that the tissues can get used to that compression, lengthening, pressure, as well as the muscles getting their flexibility. So now let's go ahead and take a look at the different types of dilators that are available to you. The first set of dilators we're going to talk about are silicone dilators. So there's lots of different brands out there. I'm going to go ahead and list some right now. There's Pure Romance silicone dilators, there's Intimate Rose, and Soul Source. I'll go ahead and add some links for these down in the comment section or the description of the video. These dilators range in price, but I would say that the silicone dilators are always more expensive than the rigid plastic ones, which I'll be talking about later. So the silicone dilators, why I like these is they're flexible. They have kind of a rubbery feel to them, but oftentimes patients feel more comfortable or confident working with these because they feel a little bit more lifelike. I will oftentimes recommend a silicone dilator to an individual who might have some skin sensitivity or vaginal atrophy, because this is going to be better tolerated for them. However, again, you and your physical therapist can figure out which type of dilator is going to best suit you, because I certainly never want to recommend something that is going to put a patient at some type of monetary strife, and I want them to feel like they can be successful. So the reason why the silicone dilators are nice is they start very, very small. So oftentimes you can see this is about the size of my pinky. So based on what I'm assessing with their internal pelvic floor muscle exam, that gives me an idea of what size dilator I will recommend that they start with. So this is the smallest, and then I'm gonna have to have you guys giggle a little bit. This is the biggest. So as I stated earlier in the video, if your partner or your favorite sexual intimacy aid is not this size, we don't need to work towards this one. So I'll set this one aside, okay? But you can see with each one of these dilators how they start to increase with size. So this is the next size up. Let me go ahead and grab another one, okay? So it's nice on their different websites, they'll go ahead and tell you how much each dilator increases in size. And again, you can get a sense from these different dilators, okay, maybe I'm working towards one that's about this size. Okay, I can do that. Versus working on one that's about this size. Now, the different brands that I spoke of can have some different flexibility. I have found that the Pure Romance and the Soul Source dilators have a bit more bend to them, whereas the Intimate Rose dilators have a little bit less bend. This can be nice because if you're working on stretching the tissues using the dilator, the Intimate Rose ones are a bit easier to grasp and then move side to side. Also, the texture feels like more of a not sticky surface. It has a very kind of smooth sheen to it. I think it's important to note that Soul Source dilators and Intimate Rose can be purchased in a small, medium, large package. So you don't have to buy the entire set of 8. Oftentimes, if I know that I can place my finger in the vaginal canal with no pain or difficulty, then I know that they can tolerate a size 2 dilator. So then if we're starting you out at a size 3 dilator, you can oftentimes get away with purchasing the medium set. So again, I find it most helpful for patients to work with their providers so that they can figure out which grouping they're working with, and maybe you can find a more cost-effective way to accomplish that if you're really, really liking these flexible, bendable types. Now we'll go ahead and jump over to the next type. The next type of dilators that I'm going to discuss are the rigid plastic dilators. Oftentimes, these are a bit more cost-effective. The dilators that I tend to recommend for patients that are rigid plastic are vaginismus dilator set. If you just put that into Google, you can find them. But again, in the description of this video, I'll go ahead and have a link to these different products. Some other rigid dilators, we have these, which you can kind of see them. They are a clear acrylic. These you can't purchase online, but I wanted to show you the nice thing about something like that is the length. This can be easily used to stretch tissues. So oftentimes with patients who feel comfortable and confident doing so, I love having them use something that has this kind of extension or handle on it, because then you can really stretch those layer 1 and 2 muscles to be able to increase your tolerance to increasing the size of the dilator. So I really like that. This last set of dilators here that I'm going to show you that's a rigid plastic is called the Vuva. I believe that's how you pronounce it. Again, I'll have links down there at the bottom. This looks very, very similar to the silicone dilators. The difference is it is hard, and these also have magnets in them. Supposedly the magnets are going to help to facilitate that down regulation and muscle relaxation. I personally haven't had too many patients use these, so I can't speak to them. But I most commonly recommend the vaginismus dilator set. And this, you can see, has a nice way that you can click it, this handle here. Then you use another one and you just place it on here in the side. So I'm placing it and then just clicking it into place, okay? So after I'm done showing these, I'll briefly talk about some lubricants that you can use for these. But again, this is just really nice, easy, quick to move from size to size, okay? So I like these. They're about $45 price point for these, but this is definitely a great tool that makes dilation more accessible to all populations. So I will have a video later that discusses all about different types of lubricants and when you use them and how you use them, but it's very, very important when you're dilating to utilize lubrication. When you are working with the silicone dilators, it is important to never work with a silicone lubricant. That will cause breakdown of the product, and we just don't want that occurring in our body. So make sure you take a look at your lubricants. Don't just assume that they are water-based. They have these new types of lubricant that are a silicone water hybrid. So there's lots of different brands out there. Some of my patients like things that don't have any of the parabens or anything in there. So I commonly will recommend KY, Astroglide. There's Sliquid. Sliquid also has an organics brand. There's another product called Slippery Stuff, which is one of the ones I have right here. Also Aquagel. Sometimes the dilators, when you order them, will come with a lubricant, which is really nice because then you know you're getting one of the water-based ones. Water-based lubricants are also a lot easier to clean off. So if you're dilating and you find that you are using a silicone lubricant in your own personal kind of bedroom play, go ahead and maybe leave that for the bedroom and invest in some water-based lubricant. And again, I'll have links to all these different products in the description. I hope you found this video informative, and I want you to know that you're not alone. You're not the only person that has to dilate. That's why there are so many different products out there. So if you're feeling confused at all, please, please find a physical therapist close to you that can help guide you through this process. We want you to be successful. We want you to understand why you're doing this. And I hope that this video helped maybe calm some of your nerves or understand why we might be going down this route. And please know you're never alone. Have a wonderful day.